Welcome, welcome. Thank you for your patience as we were just dealing with a couple of technology issues behind the scenes as you were in the waiting room, and we appreciate you joining us for today's session. If you want, feel free to put into the chat your name, your organization, and maybe where you're tuning in from. As we just allow a couple more people to get into the space, and then we'll jump in and get started. And feel free to share any other information that you think is valuable or anything you want us to know about you. We're really excited to spend some time with Mitzi Moody today to discuss engaging community in assessments. Recognize a couple names. Hi, Carolina. It's nice to see you. Hi, Nell.
Hi.
Nell is here with our steering committee for the Peer Recovery Center of Excellence. And then Cindy and myself, who also work for the Peer Recovery Center of Excellence. So to be mindful of time, we're at 3 minutes after 12, so I think we'll officially get started. So again, welcome everyone to the Peer Recovery Center of Excellence Learning Collaborative on Community and Stakeholder Engagement. Today, we are going to be talking about engaging the community in assessments. We have Mitzi Moody from Creative Thought Consulting Group with us. Next slide. This is just an announcement that this funding was made possible by a grant from SAMHSA, and that the views expressed within today's presentation are not necessarily the views of the Department of Health and Human Services, and those are the views of the presenter. Next slide. The Peer Recovery Center of Excellence works within 4 core areas. So we look at the integration of peer support workers in different settings, building and strengthening the capacity of recovery community organizations. We work to develop and strengthen the peer recovery workforce, and also providing evidence-based toolkits and resources to our diverse set of stakeholders. Next slide, thank you. If we want addiction destigmatized, we need a language that's unified. We never want to describe a person as their disease or their diagnosis. We always want to use person first language in everything we do. And then a little bit of housekeeping. If at all possible, have yourself on screen. We want to have an interactive, engaging session where you can come off mute and ask questions in real time as they arise. Today's session is being recorded, and that will be posted to the landing page for this series. And when you're not talking, if you can keep your line muted, that would be great, just in case you have some background noises that you don't want us to hear. And then feel free also, in addition to coming off mute, to use the chat feature to raise questions or engage with the content that's being presented. And I will do my best to pull that content into Mitzi's discussion. And with this, I'm going to hand it over to Mitzi. Welcome. Thank you for being here.
Yes, thank you, Chris, and welcome everyone. I'm in presenter mode and I want to see your faces, but it's hard. I'm scared to get out of it because I think I won't be able to get back into it. So I'm going to go ahead and get started. But as Chris said, I'm Mitzi Moody. I am a social worker by trade and have a lot of experience with behavioral health, the behavioral health community. And I'm really excited to be here today because in one of my former jobs, I worked at the Franklin County, Ohio Alcohol, Drug, and Mental Health Board, and had the privilege of being able to serve the community and really help individuals in the behavioral health community recognize the importance of peers and all the work that you all do. And so I'm very passionate about being able to work alongside you all as we're working towards addressing any concerns in the behavioral health community or in the recovery community, really being able to help see people living at their best. So again, thank you for having me today. Today we're going to talk about engaging communities in assessments. Before I jump into the material, I just want to kind of talk a little bit about kind of the learning collaborative as a whole. One of the things that you'll find are that it's set up so that there are workshops each month, but there's also a extension learning. So what that extension learning is that each month there are additional materials for you to engage with, so that we can really help bring the learning that you're doing in these workshops, that it can help jump it off the page or out of the screen and really help it come to life in your world. And so the extension learning is just additional information and opportunities to really engage with the material. And so one of the things that we did last month was invite everyone who was participating to try out some of the tactics that they were learning and share their stories. So there was a list of different ways you could engage your community, ranging from writing your senator to participating in a focus group, or liking something on social media, or creating a fact sheet or posting on social media. And I just wanted to take a minute right now before we jump into this month's material to just see if any of you were able to do that and how that went for you. If you just want to, kind of jump right in, feel free to do that. If you want to type in the chat, feel free to do that as well. But I'd love to hear your stories. I'm going to work on trying to see your faces.
If you weren't able to participate this last month, we really focused on advocacy and how to kind of demystifying what advocacy is, and then finding ways to do advocacy, to advocate big or small. And so if you didn't have a chance to participate, but you can think of a situation where you practice some advocacy in the last month or so, feel free to share that as well.
Jessica, yeah, jump right in. You can just
so in the last month, I've done a lot of classes. So this one, I should have pulled my stuff out from the last class and I didn't. But I do know, I do remember when you started talking, I do remember that class. And so in the last month, what we did was we kind of reached out to an area church, the place that I work with. I'm a volunteer there right now because I'm in the middle of getting my CRSS. But we did reach out to a church, and we've actually been, I want to say collaborating, but not, full collaboration, but we are working together. And the church had started doing some community engagement themselves, and working with certain people who need help in life, with numerous things. And so we've been working with them, and it's actually been going pretty smooth because the things that we don't have to offer, the church does. And you know what I mean? And vice versa. So it's actually been working out really well. And they've sent us a few people that we're working with now, that are getting some of the resources that they need in their life. So I do feel like anytime anybody can work with another group, anytime one group can come together and work with another group for the greater good or for that something positive, it really shows through. And even on a smaller scale, all them smaller scales add up to a big scale. So I think it's very important. So I know that's one thing that we've done that's kind of newer. Usually we don't work with churches because we're not a faith-based program. So it's something new for us, but it's worked really well so far.
Mm-hmm. Yeah, thank you so much for sharing that, Jessica. It's great to hear kind of how that went for you, and appreciate those words of wisdom that you're sharing with all of us. I think, as we go through this whole series, I think you'll see that collaboration with in the community is going to be a huge way of engaging community. Like you said, the faith-based community, or even just other groups in general, can reach people in ways that we may not be able to reach. And so partnering with them, I think, is a way for us to expand our reach, to really be really be able to help people with recovery. Any other things you'd like to share with the group around just kind of your experience with advocacy or taking that first step? Go ahead and jump in, Edward.
Hey, oh God, oh geez, I've got to correct that because the only people that call me Edward were my grandmother and mother, and they're both dead. That's no, you wouldn't have known that. Also in telemarketers, the yes, I know I'm being set up. Can I speak to Edward Johnson, please? It's like he's dead. I think this fits in the category of advocacy. Or I viewed it that way, but 3 weeks ago, we set up and I did a basic understanding addiction and opioid use disorder and medication assisted recovery and harm reduction. And we had a panel discussion with folks that were in recovery from opioids with the Charleston Police Department. And it was a day-long training. The only fly in the ointment was that all 30 people were voluntold to be there. So it was a bit, was one of those, it's like, yeah, I'm going to be typical Ed and say, initially it was pretty cool because 10 of them were just hotter than lava. But you know, hot does not make up for attitude. And finally, so about a hour and a half into it, I said, okay, you know, what can we do since you're here and obviously you don't want to be here? How can we help you enjoy this? Now, granted, they were much more engaged when we had the people with lived experience. But it was just me rattling on that they seemed to, you know, groan at. But it was, I mean, you know, they did seem to increase their knowledge. And we probably, and I guess this is one of the things that I've had to try and focus on too with respect to advocacy is at least I think we got through to 2 or 3 of them, hopefully a bit more, which, you know, the old adage of it's better to light a single candle than to sit and curse the dark. That's progress. So yeah, there we go.
Awesome. Yeah, thank you, Ed. Thank you for sharing. I think that's a great experience because like you said, when you said that they really perked up when they heard people with lived experience, I think that's a huge way of engaging people is stories, right? We don't want to know someone, we want to know their story. So I think including people with lived experience in your advocacy is a huge benefit to engaging people. And then also really, like you said, you know, the numbers of people that we might reach a large number of people, but those that really take on to the message at that time, it's, you know, maybe the next time we'll reach the next people. But continuing to go out there and kind of fight that good fight and engage people in the community, I think is so important.
One quick thing to add too, the 2 folks with lived experience specifically talked about experience they had with law enforcement and when law enforcement could have intervened in a positive sense to help them into recovery. And that got their attention very much too. That they could have been in a position to make a difference. So that was sort of cool too.
Yeah, stories are so powerful, and we're definitely going to touch on that today as well, but it's just amazing how powerful a story can be to really help resonate with people that we're trying to engage and bring along with our efforts for community change. So yes, thank you for sharing, Ed. Maggie, I see you have your hand up as well. And then Michelle, I see you, and I'll jump to you next.
I was just gonna say we have started trying to work in closely with like probation and DCS to get referrals from them and kind of getting our program out there in the community for people to recognize, and started a Facebook page, and it spiked likes like crazy. And so we're reaching all kinds of people in the community that, you know, we wouldn't have reached otherwise. That was really helpful too. And I mean, I went through and individually check marked each one of the people on my friends list, over like 1,200 people. But getting the probation officers and the forensic social workers and the DCS workers involved has really made our program grow and expand, because they we're starting to get credibility, and they're starting to trust us with their people and know that our educational program is suitable to some of the clients' needs. So
yeah, that's great news. Thank you for sharing that. You know, I love to hear that, and I love to hear about social media as a tool for really engaging people. And even a lot of times we think of advocacy as this big, great thing that we have to do, but even social media and having likes and posts, that is that's advocacy, right? Of really helping people get informed and become aware of our change efforts, and then helping get them kind of building that base and helping to get them involved with it as well. So thank you, Maggie, for sharing that. And Michelle, I'll turn it over to you now.
Thank you. Last month we held a symposium for 988, which for folks who might not know is the new, it's going to be implemented nationwide, and it's a new 3-digit number, 988, for mental health or substance use crises. And so it's supposed to be an alternative to law enforcement. And so at our organization, we have the privilege of being able to sit in on committees for system improvements, especially 988. But we felt like it would be really important, especially because there's so much discussion among these committees about peer involvement, but then there's 1 or 2 peers, we're there representing all peers across the state, and we only work in one. We have specific types of services we're offering. We're not necessarily integrated in the crisis system where we know that there are peers there. So this symposium was really an opportunity for us to share information with folks, but also to receive feedback from peers about what are their concerns, what does on the ground peer crisis work look like, and will it fit in with the plans that are happening around 988. And we were really happy. There were 150 people that attended, and during the break we utilized that opportunity to have anyone who wanted to share their stories related to crisis involvement. They could either take a 20-minute break or talk to us for a few minutes so that we could have those stories as well. And we just felt like this was really important because there's a lot of mistrust in the crisis system, understandably so. And so this is a really positive change. And so how can we make sure that feedback is being articulated in the spaces it needs to be articulated? And how can we make sure that we gain more trust of this new service so that people know that they'll actually be safe when they call 988?
Yeah. Thank you so much for sharing that, Michelle. I loved hearing that. And I love the idea of a symposium. And again, another strategy we'll talk about today, but I love the idea, when you said that, there may not be as, you all were 2 peers representing kind of a state wide network representing the state, when you know that there's other peers that are maybe more engaged in crisis work. That's one of the things we're going to talk about today, is how do you engage not just your community, but how do you all engage with the larger behavioral health community, so that we're infusing more peers into the process, into a lot of these processes, right? In crisis, in hospitalizations, in a lot of the work that you see in behavioral health. How do we engage with that larger community so that we see more peers represented at the table? So thank you for sharing that. And I think I'll take one more. See one more hand, Carolina.
Hi, good morning. It's Carolina. Thank you. No worries. Thank you so much. So for us out here in California, I think for advocacy, it's been being part of SB 803, which is the certification process for the peers out here, and having SUD at the table, participating in as many listening sessions and focus groups as possible. As well as just locally in our city, having dinners with other community-based organizations that include the local hospital, the nonprofits that help the unhoused, different organizations that are already doing amazing things, and just really trying to bring to the forefront what an RCO is and how we are valuable to the community, because nobody knows what RCOs are out here, unfortunately. So every opportunity we get, also being part of the recovery advocacy project, and putting a campaign together to promote RCNs and RCCs throughout the state of California, one county at a time, is what we're working on out here too. So thank you.
Yeah, thank you for sharing. It's great to hear, right? And this is the thing that I love about learning collaboratives is that I want to make sure you all have the opportunity to hear from each other and the great work that you all are doing. Because I feel like with learning collaboratives, especially a national one like this, that something going on in California could really be impactful to something in Iowa or in Ohio. And you'll really be able to meet people in different areas and really have those conversations. So you'll notice that when I do workshops that, I'm going to give you time to talk amongst each other, to really identify people who have maybe experience in advocacy or experience in focus groups or experience in different aspects of symposiums, so that as you're listening, you're also listening to see who among your group also has that experience, because after the workshops are done, you'll still have your network and your relationships and be able to say to one another, hey, Carolina, I know you were doing focus groups and I know you were working with getting people housed. I have some questions. Do you mind if I ask them or run those by you, right? And so really, this is why I love learning collaboratives and want to foster that here. So as I'm presenting today, if there's questions that you have or comments that you have, feel free to jump in, feel free to put it in the chat. I'm okay with that. I can be flexible. We're going to get through a number of things today around how to engage the community in assessments. And my job is to make sure we get there, but I don't want that to be to the exclusion of you all being able to engage and talk. I'll make sure we get there, but I do want to hear your thoughts, because I think it's beneficial to everyone in the group. So I'm going to go ahead and get started. Today, we're going to focus on the process of community change. We're going to talk about that just a little bit. We're going to talk about community assessments, and then we're really going to spend most of our time on the tools for engaging community in assessments. And then I kind of just already talked to you about, how my passion for learning collaboratives and how to be able to build community within here. So some of the tools I really want you to leave with are tools to engage your community. So I want to look at the tools from 3 different focuses, right? So tools to engage your community. You should have tools when you leave that you can take as you lead and do good work in your community. But I also want you to have tools, which are going to be the same tools, but we're just going to look at them a little bit differently, of how to engage that larger community, that larger behavioral health community, so that you all can advocate for the inclusion of peers, and that you'll know what processes they're going through, so that you can then kind of open doors for yourselves and others to really be at the table for those conversations, because your voice is needed, right? And then the third area we want to look at is taking those tools and talking about how do we engage subgroups within the recovery community. So every community has subgroups within it, and we want to make sure that we're elevating the voice of everyone in that community. And so we want to talk about how do we also use these tools to really be able to engage the subgroups that are within the community, the recovery community. So the first thing I want to do is, because I know we're all at different levels or different areas of knowledge, we're all experts in something, and then we all probably have questions and other things. And so I want to be able to talk first really briefly about kind of the process of change, what that is, and then community assessments before we start jumping in the tool, just so that we all have a really good baseline from which to have our conversations. So the first thing we talk about is the process of change. We're really talking about how do we facilitate change in a community. And if any of you for those of you that were at last month's workshop, we talked about advocacy, and we touched a little bit on, advocacy and models of change. But if you were able to take a look at the extension learning, one of the tools that were in there was the community toolbox. And within that toolbox, there are a number of different models for how to do community change, right? For a process for community change. This is just one of those models that I pulled out. But what you'll see is that when you're looking at a model, there's very similar, a lot of them have similar components to it. So Most of the models will have an assessment component. Then they'll talk about capacity building, planning, implementation, and evaluation. They might rearrange how this process is done a little bit differently, but ultimately it comes down to this. And I really like SAMHSA's model for the strategic prevention framework because it covers all of these in depth. And I wanted to pull this out for you as well, because this is one good cycle of change. And there's a number of resources on this from SAMHSA about how to engage in this cycle of change. And I do want to note that just because it says prevention, it's not just specific to prevention. Substance use prevention, you could also utilize this with any type of program or community planning that you're doing, any program planning that you're doing. You could walk through each of these steps to really make sure that you're doing a full, walking through that full cycle of community change. And so today we're going to focus on assessments, but what you'll find is that as we go through next month's workshop, it's going to talk about capacity, right? I think the title is around organizing, but really we're looking at capacity and how to build capacity, how to get people involved in your work, how to encourage people to come and join you. So we'll talk about capacity next month. And then the following month, in June, we'll talk about planning, implementation, and evaluation. And so we'll go into those. So today I really want to focus on assessments and what are the strategies and the tools that we use when we're engaging people in assessments. So a community assessment really answers the question of how do we understand the concerns of a community? And when we talk about concerns of a community, we're talking about things like, for example, in the behavioral health community, long wait lists for treatment, limited treatment options, right? We don't have a full array of treatment services in our community. We also might be looking at a concern around the criminal justice system's response to individuals who are using substances. We might be looking at individuals that are experiencing poverty or financial difficulties. We might be looking at how employment interacts with behavioral health or co-occurring mental health. We also might be looking at issues around increased interaction with child welfare, or looking at community norms that promote substance use, or one that we're all kind of struggling with now is that workforce shortage. So again, when you think about community concerns, there's a number of community concerns. And as you guys are probably doing in your work now, identifying what those concerns are, and really kind of, that's where you want to head with your efforts to change. So I do want to put it out there and ask kind of what are the concerns that you see in the recovery community today? You can jump in, Michelle.
One concern that I see, at least in our state, is peer drift. So AKA, my organization actually has we have connected with us 20 affiliated peer-run centers. So it's like we see that kind of authentic peer supervision happening, where there's kind of patience and working with peers to develop their specific skill sets. But sometimes we see, as peers are expanding across the state and in various clinical settings, this idea of like, what actually is the role of peers, and are peers being supported in the way that they should be supported, and is that transparency there, and is there that respect, and things like that. So kind of finding like room for advocacy related to peers sharing with like clinicians or providers, like really what it means to be a peer, and that we can't just kind of willy-nilly include peers in grants without truly understanding what their role is and what their strengths are.
Yeah, absolutely. We're seeing that in Ohio as well. So thank you for sharing that, Michelle. Yeah. Other thoughts on concerns in the recovery community? I think I saw a comment around stigma being a big concern as well. Other things that you're seeing? So when you think about what's going on in communities, and you think about what those concerns are, I feel free to chat if you're jumping in. Low pay, right? That's always another one, right? Yeah, low pay is a huge one. Reentry housing is another one. adult reentry grant for harm reduction and reentry housing, lack of housing help for felons. Absolutely, right? All things that we're seeing that are that are issues that need to be addressed in the peer community or in the recovery community, right? And even in the larger behavioral health community as well. So when you're thinking about assessments, you're really looking at that question of, okay, we're presented with this concern in the community, and now we really need to understand it, right? So that assessment process is the process of understanding that problem. So we're asking questions, we're wanting to know more information. So some of the questions we might ask are, what's the community's concern? Who's impacted by the problem? Are there certain groups more impacted than others? What are the root causes of the problem? What's sustaining the problem? What's the history of the problem? And then also, what are some of the strengths of the community? And then what has been done to address the problem? So as you're doing that assessment, those are the kind of things that you want to be asking. Go ahead and jump in, Jessica, and then Carolina, you can jump in right after her.
I was just going to say, one of the problems that we're seeing here too is when it comes to jobs for people with records. So they get out and then they, want to do better, and we got a good setup going for them, but then they go to get the job and, people just see this sheet and they don't want nothing to do with it. They're asking all the right questions to get this information, but then when they get it, it's like, okay, well, we don't need you, you're out or whatever. So it's like, I feel like people in our community are, on one hand, we're saying, we want to see you guys do good. We want to see you do great. We got programs, but then they come out and you're denying them of that chance to do better, which drives them back into the street to deal or do whatever they're doing to make money because they're not able to obtain a job because of this record. So it makes it really hard, and it's like a cat chasing its tail. And we're in a smaller community too. And honestly, I feel like it's harder in smaller communities than in bigger communities. I feel like the stigma is a lot thicker around things like that. And people know your business. The manager down the street knows who you are from a friend who knows somebody else. You know what I mean? So it makes it really hard when people come home to be fully functional and to change their life around.
Mm-hmm. Yeah, thank you, Jessica. Yeah, I think that's a great example of kind of a concern right now in the recovery community and behavioral health community that really could benefit from kind of taking a look and a deeper dive through an assessment of really who's impacted and what are the root causes and what are those things that are continuing to keep people kind of stuck when they come out of jail and not being able to access employment because of their record, right? What are those things, whether it's stigma or other things from the community that continue to kind of hold people in that kind of holding that cycle? An assessment would be a great tool to kind of looking at that and really starting to see kind of what are the strengths of those individuals and of the community, and then what are kind of the root problems of it, and how do we start to even formulate our thoughts around what the problem is, understanding it, and then eventually getting to solutions to it. So thank you for sharing that. Carolina, I'll turn it over to you as well.
Hi, I really like this because yesterday I was actually like in this big listening session / focus group about these very things. And one of the things that comes up like in our community out here, well, Riverside County, is the lack of resources of prevention. And when we talk about prevention, also prevention from return to use. Not just the initial like of youth and things like that, but also once you are in recovery, what do we have, to have like sober spaces and community where people can come and connect without having to go through the crisis modes of going back into treatment or whatever, that may look like. Like, why do we have to go that route in order to get help? And then also with the reentry, I was just sharing in the chat, and I think this was a California grant, so I'm not sure how it is for the other states, but there's huge reentry grants right now specifically for housing first, where nothing is a question, like that's the harm reduction houses. And then working on the ban the box, right? For those people that do have the records. In California, we've been able to push that, ban the box where they can't ask that question in the employment when people go and apply, but also having things, excuse me, God, phone calls that keep coming up is having programs within institutions that develop the workforce that organizations out here can already have. And a perfect example is like in Oakland, California, they call it Planting for Justice. And it's this big like horticulture nonprofit that like people in prison are already learning how to do this, and they get to come out directly to have jobs. Unfortunately, it's only in Oakland, and they're not high paying jobs, but they're living wages. As well as like the forensic peers. That's something that's not happening in California, but I see a huge possibility of getting people already ready while they're in there. So when they can come out, contribute and give back and actually have a living wage job as a peer in the forensic setting from where we come out of.
Yeah, thank you. I appreciate that, because that fits right in with what we're talking about with the assessment, right? Another question we want to ask in the assessment is what's going well and how has this problem been addressed before in other communities? So when you talk about what's going on in Oakland, right, of how they're addressing kind of reentry, that's something that we want to do when we're looking at assessments, to really be able to say, this is the problem that we're facing. Where else? What are other bright spots or other models that are working? As we start to think about what are some of the solutions for our own community. And then when you do the community assessment, you really want to gather your data, but where do you get it from? So the first place you want to gather your data from are the institutions, the agencies. You want to get annual reports. You want to get aggregated information from agencies about what the needs are, or what people are experiencing, or what people are presenting with. Or they're seeking services for. But that's not all that you want to get information from. You have to talk to the community as well, right? So a lot of times you'll see a community assessment where the focus is just on getting previous data or kind of engaging with, the agencies and the organizations in the community, but we never really talk to people. So if you're going to do a community assessment, part of that assessment is talking to both. You really want to make sure that you have the community's voice and that you're understanding it from the community's point of view as well. And we'll talk about some strategies of how you do that. And I think you guys have already answered this question of how do community assessments apply to your work, right? You've talked about doing focus groups. You've talked about doing symposiums. You've talked about how you're engaging with individuals, or even in your work, you're learning of gaps in services. Where maybe there is a housing first, or there's some type of service, but maybe there's a gap in another area. I think it was around prevention, right? We do a lot of prevention up front with youth, but what type of prevention is there for people that are in recovery to prevent them from relapse, or prevent them from going back into substance use, right? So you're identifying gaps in services, and that's all great examples of how you all are using community assessments in your work. So I really wanted to kind of give you that brief overview of kind of this is what assessments are, just so that you're aware, and that we're all kind of at that baseline. I know some of you are experts in assessments and could teach this class, and then others of you are looking for more information. And so I wanted us to just make sure that we definitely have that that baseline. And then thank you, Trish, for weighing. Says it assists in creating logical models for how to create an implementation plan for services. And you're absolutely right, right? So we do that assessment so that we can get to kind of a logic model and a strategic plan and implementation plan for services. Mm-hmm. That assessment is what is going to guide us for it. So yes, thank you, Trish, for weighing in on that. So now I want to kind of give you some of those tools for engaging the community. Right. And we talked about these tools again on 3 different levels, how to use these tools to do the work and lead the work that you're doing. Right. And I emphasize lead. So lead the work that you're doing. How do you also use these tools to engage with other communities or larger communities, like the larger behavioral health community? How do you use these tools to engage with them so that you all are included at the table in discussions? And then also, how do you also use these same tools to engage subgroups within the recovery community? So the first thing I want to talk about is appreciative inquiry, right? appreciative inquiry is something that I really love because I think some of you may have heard it as strengths-based. Some of you may have heard this as asset-based, but it's really that idea that we're looking at the strengths of people, right? And so when we are engaging with communities, especially to do assessments, we have to first take this stance of looking for strengths. And I love this image because a lot of times, we've heard it before, is a glass half empty or is it half full, right? When we come from a deficit-based model, we're really looking at what's missing. And that's how we're phrasing our questions. That's how we're looking at the community as a problem or what's missing versus what do we have, right? That reframes how we're looking at the community, and it also reframes the solutions that then become available because we're looking at what do we hold and how can we use what we hold to address any concerns that we're seeing in the community. I do want to emphasize that this model of appreciative inquiry isn't saying that we ignore any concerns in the community. It's just saying, how do we approach them? And we approach them from saying, okay, what do we have? And how can we use what we have to then help develop solutions for any of the concerns that we're seeing? I'll give you a really good example. I was listening to a podcast the other day, and it was about, I think the organization was Save the Children. And it was talking about Save the Children had and was setting up one of their one of their satellite offices in the Philippines, probably back in the 90s. And they had the Philippines was experiencing a lot of children with malnutrition, and they were wanting to have some help from Save the Children so that they could address the malnutrition among their kids. So one of the things that the Philippines the government had already done was kind of look at this problem. And when Save the Children came in, they kind of told them, hey, this is what's going wrong. This is what's happening. These are all the problems. And this is what we think it's going to need to take it. And the things that they had came up with to solve the problem were these big system changes, right? Changing the water supply or finding new ways to generate clean water. It was going to take an overhaul of some of their kind of social service systems within the country to really be able to make an impact on malnutrition. But when Save the Children came in to work with the community, the first thing that they did was look for the bright spots. They looked at what's going right. And so they went and they talked to the people that were there. They didn't come in with their ideas and place it on the community. Talk to the community to figure out what was going on. So the staff there went around to the different villages asking the moms, are there children that aren't experiencing malnutrition and what's going right with them? And they found that there were children within the Philippines that were not experiencing malnutrition. And they really honed in and focused on these families. And they had those families kind of explain what they were doing with their different feeding practices for their children, what types of foods they were having for their kids. And what they found was that the kids that were doing well, their parents were, instead of giving them 2 big meals a day, they were spreading out the same amount of food over 4 small meals. And those 4 small meals were better for the children because they were able to absorb the nutrients from the food better and help prevent their malnutrition. They also found that the families with children that were doing well, that these children had, the families had mixed in kind of sweet potatoes. So like it was viewed in the community as kind of a low class food. And they had mixed that in with the children's food. And these children were doing better because the sweet potatoes had a lot of nutrients that they needed. So what they ended up doing was kind of talking to the community, and through these focus groups and listening sessions and talking to the community, they were able to figure out what was going right. And when they found what was going right, the solution was right there in the community. And so they were able to talk with the community. The community actually led the efforts, and they were able to significantly decrease malnutrition in the Philippines just by having an intervention that came from the community and really looking at the bright spots. And so that's why I love appreciative inquiry. When you're trying to engage people, it goes over a lot better. It goes over well when you're looking at their strengths versus when you come in looking at their weaknesses. And we can all kind of think of moments in our lives where people have come and looked at our weaknesses and really didn't see the strength within us. And vice versa, when people have seen the strengths within us and what that meant to us and what we were able to do as a result of it. So this is definitely one of the tools of appreciative inquiry that is really, 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 really powerful in engaging people in in your assessments to really understand a problem and what's going on, and really to invite them into your work. Another tool, and I'm gonna, if you have comments, feel free to jump in, put it in the chat or jump right in. I'm okay with that. But I'm going to move to the net. I'm just going to kind of move through these different strategies for you as well. And then we'll have about 30 minutes at the end as well if there's additional questions that we didn't get through this time. Coalitions are another strategy to use. These are voluntary formal agreements. Collaborations, I heard that before when we first started talking about collaborating with other groups in the community. They're collaborations between groups or sectors of a community where each group retains its own identities. So they still are their own organization or their own agency or their own group, but they're all working towards a common goal of really building a safe, healthy, drug-free community or any type of goal that they have. So coalitions are great because there's many benefits of it. So when you bring people together in a coalition, everyone brings their resources together, whether that's their knowledge, their expertise, maybe it's funding, maybe it's like manpower or staff power. Everyone's bringing their resources together to say, hey, this is what we have. And now as a group, what can we do with it, right? Have any of you had experiences in coalitions that you want to share?
I will.
Okay, thank you.
Okay, this is Dr. Mary Robertson from the Northern Illinois Recovery Community Organization, an RCO in Lake County. So we have been part of various coalitions throughout the years, and it's been really, really helpful, particularly since we started the RCO, to get the message out about stigma reduction and all of those things. One of the major coalitions is an opiate initiative that got started when all the overdoses were taking place, and when we started our conversation about a ROS and establishing the RCO, those coalitions were really, really helpful. And involved in the coalition is a lot of the partners in the community, like the substance use providers, mental health, legal, and things of that sort. So that's been really, really successful and really moving our recovery-oriented system of care ahead. So I just want to share that piece.
Awesome. Thank you so much. I think you bring great points, right? Especially I love when you talked about who's involved with their coalition to address recovery in the community. I think, thinking about like having those partnerships with behavioral health agencies, with peers, with law enforcement, with different maybe state agencies. I think it's great to hear the number of people that are involved with it, because the power of what you can do with all those people involved is amazing, right? I think someone said earlier today, the things that they were able to do when they partnered with the faith-based community and the people that they were able to reach that they may not have been able to reach on their own, just amplified the work that they were able to do. Carolina, go ahead and jump right in.
Sure. Another form of a coalition that we just became a part of is the governor in California is trying to put in care courts, which are basically forced treatment for unhoused or mentally ill. That has a lot of holes in it. And so we've come together with a lot of different organizations that cover mental health, peer-to-peer, housing, disability right advocates, the recovery space, everybody coming together to act as one voice to fight against this forced treatment that's trying to be put down in California right now.
Mm-hmm. Yeah, that's a great example. Yeah, coalitions can form to even oppose things too. So I think that's a great example. Thank you. Jessica, you have the floor.
Okay, so I had a question actually. I don't know if anybody's done this in this room, but I'm just wondering what it would look like. While we were talking, I just got this idea, there are different roads to recovery. Everybody's road looks different and different things work for different people. Now where I'm at, we use smart recovery. That's what we use. But we do have like an AA chapter, in our area. Has anybody ever come together on that? Like, because most people that make it through AA, whoever AA usually does work for isn't probably isn't going to have the same success out of Smart Recovery. And the people that Smart Recovery, deals with is sometimes AA is not accessible for. So I'm just wondering like what that would look like if that AA and that Smart Recovery not necessarily come together like in all their meetings to do their meetings together, still stay who they are. Like you would just, said in this, you still stay who you are and you still follow what you follow. But at the same time, is there some collaboration where we know if this isn't working for this person, we're going to send them your way or vice versa, because, sometimes different programs work better for different people. So really that's just a question of mine, if any like Smart Recovery and AA had any kind of collaboration, because they seem to be opposing sides. You know what I'm saying?
Yeah, I think Mary and Ed have some feedback as well. So, and Carolina, so I'll turn the floor over to you all.
Yeah, very good question, Jessica. When we started our RCO, our Recovery Community Organization, here in a robust recovery community already, including Smart Recovery and all of the other pathways that's being used in the 12 steps, there was a lot of pushback. So one of the things that we did at NERCO was to host an event to introduce NERCO, our Recovery Community Organization, to the 12-step community. Now, I grew up in Narcotics Anonymous. 30 years clean almost in that particular arena, but I knew that there was a lot of pushback, from, the recovery community about stigma reduction and anonymity and the traditions violations and all of that. And AA has one message, NA has another, Smart Recovery has this, and so on and so forth. So we brought them all together under one roof, to really kind of talk about that pathway, because no pathway, as you said, is, better or less than the other. It's just a matter of what that person chooses. So I think that, the answer is to bring everybody together and know that we're headed in the same direction. It's just that we're on different streets. You may be taking I-290 downtown Chicago. I might be taking 41 to downtown Chicago. So that's how we looked at it. So thank you.
Yeah, thank you. Thank you. Ed, do you want to jump right in?
Sure. One of the deals for us that we work continuously with our peers on is it's our responsibility when we're working with somebody to help them figure out what's going to work for them. So it's not a matter of having somebody in AA telling somebody who's having trouble, well, why don't you go to Smart Recovery? That's what we do. That's what we help that person see that, maybe this, you might want to try this because you see, because it looks like, AA or NA isn't working for you, and so that's part of the deal. As far as I will be totally candid, it has been, and I mean, I've been in 12-step recovery for 38 damn years, and it wears my ass out trying to get 12-step people to be okay with, what a recovery organization is like. We are not trying to steal your cookies, for Christ's sake. It's a matter of looking at it, what's going to work for the person we're working with. And no, it's not an anonymity violation if I say that I'm a person in long-term recovery, as long as I don't say that I'm a member of Alcoholics Anonymous, for crying out loud. It's been real challenging. And one of the things that we found a little bit successful is if you can get somebody who is in, whatever the fellowship, who's sort of like, one of the elder statesmen, if you will, to get on board and to have a positive, view of what you're doing and realize that it's bigger than AA, that what we're doing is about more than just a 12-step. It's about, getting people into recovery, whatever works best for them. And yes, one last thing, we offer all recovery meetings at our center. And it's amazing the number of people who attend that also go to 12-step, and they like our meetings a little bit better because they're not getting beat up. Have you talked to your sponsor yet? Have you prayed about it? So anyway, and no, I haven't had too much caffeine. I drink decaf. Thank you very much. So I'll be quiet.
Thanks, Ed. Carolina, do you want to jump in?
Thanks, Ed. I got a lot out of that.
Yes. Thank you, everybody that shared. This is such a huge topic for us too in our community, where there's no other meetings outside of 12-step meetings. I mean, like, none of the other recovery meetings exist in our valley. You have to literally go to other cities. So we are beginning an all recovery meeting, as well as what we're trying to put together is some kind of like educational, informational component of like reaching out to the other modalities, which I'm very much a part of the 12-step community. The culture of the 12-step community, I do not agree with. The rawness of it, I absolutely do, and it works. But that's for me, and I believe it's universal. But I'm outside of the box thinker. So I do gravitate with the other people like Ed was sharing that are outside of the box, that AA is not all of it. There is more out there. And getting people, we're trying to reach out to people in the different modalities that are in recovery, whether it's SMART, whether it's Dharma, whether it's TST, NA, everything, and getting at least one person to be able to talk about their recovery within that pathway and kind of have a platform where everybody has a little bit of chance to speak, just as an educational part, like whether we have it on our YouTube channel or something like that, so people can hear different aspects of whatever works for them. Just, I don't know, we thought that would be really interesting because there are so many pathways to recovery.
Yeah, thank you for sharing. Thank you all of you for sharing. I think this really illustrates the power of coalitions, right? So I think in a coalition, being able to have these conversations really informs the other members of a coalition, right? Who may come in thinking that this is the way to do it, or this is what I've learned in a book or in theory, or this is what I've always done. I think being able to work in community and coalitions really helps then expand the ideas of what is possible, and also then helps kind of shift funding too as well, because when you have funders at the table as part of those coalitions, then they're hearing, hey, there may be a different way than what they've either researched or been told, but not necessarily have lived through experience. So I definitely thank you all for sharing that. Eric, I'm going to go ahead and let you take the floor.
Okay, thank you. I just wanted to briefly comment that I put something about it in the chat as well, is that I work across, Dharma, and I'm also I'm facilitator there, and I'm facilitator for Smart Recovery, and I've worked a lot in 12-step, and I've been very active in that back in early recovery days, not so much these days, but some keep up with it. And honestly, what Ed was talking about, just having people who are willing to say, hey, you're struggling, you've relapsed, you've got your issues, whatever, maybe you should try this other thing out as well as what we're doing here. There's no reason people can't do multiples at the same time. We have here in Charlotte, we have a number of people who I know quite well, including a couple of mentees who are in both, are attending both 12-step and Dharma recovery twice a week each, and once a week they're at SMART, because I know they're there because I'm facilitating the meeting. And so, so if they're in a bit of a crisis mode and need 5 meetings a week, there's a way to do it. I think that there's and I personally have not found much of a problem, any problem whatsoever in SMART or Dharma, with people also looking at others. And there is an issue with some folks who are very traditionalist in 12-step. But, usually you can find groups that, sorry about that. Usually you can find groups that within it, there's so many 12-step meetings that usually, here there's, I don't know, dozens every day, 7 days a week, of 12-step meetings. And usually there's some particular meeting that people can find that are a little more easy about such things and won't criticize because you're going to some other sort of meeting. Anyway, I found that for some of the folks that I work with directly, especially, it's been a huge help to them to be able to get multiple angles and multiple ways of going about it. and they may end up focusing on one particular one, but just getting something different, especially, I mostly work with young adults, and it's especially helpful in that area for me. Thanks for letting me share.
Yeah, thank you for sharing. Thank you for sharing. Chris, did you want to jump in there?
Oh, I just wanted to add, I love the conversation and appreciate how engaged everyone is. And I always am bringing like natural recovery pathways into this as well. That for some folks, it's not a mutual aid support group. It's, going back to school or joining a gym or a book club, or and there's so many ways. And so I think that's a harder group to reach when we're thinking about building out a coalition or multiple pathways, conversations to seek out and intentionally create space for people that may not use the more traditional pathways or mutual aid support, but they're improving the quality of their life through maybe mini channels.
Mm-hmm. Yeah, absolutely. And I think that's a great segue into kind of this slide as well. Of essentially what you see are different strategies, but they're all about stories, right? And hearing different people's stories, because there's different ways that we're going to engage people. So some people may be more prone to a focus group to tell their story, or someone may be more prone to a survey to say, I don't necessarily either have the time, or I just would like to share more kind of informally through a survey, or maybe they would want to be a key informant interview. So you're kind of looking at different ways of engaging people. I love these because these are about storytelling, right? And different ways of getting their story. And if you want, because of the sake of time, there's going to be, when the extension learning is active for this month, there's going to be a number of resources to help you know how to run a focus group or to complete surveys or key informant interviews. So the details are there, or public forums, listening sessions, and community conversations. These are all tools that we get to kind of elicit people's stories, right? They're tweaked a little bit. Maybe a public forum is more about having kind of like a town hall, where a listening session will be a little bit different, where you just kind of open up the floor and hear people's stories, right? And community conversations is kind of a small, intimate group of people that kind of walk through a day-long series on talking about maybe substance use or any of the issues that they see in their community. But I love these because it fits to really talking about how do we engage people and hear their stories. And when we hear their stories, we know the paths that they're looking for, right? We know the different paths that they want to take to kind of get to the same end goal, but it's just different paths. Thank you all for sharing that.
Can I just chime in one thing, Mitzi? Just it's a reminder to me that the community needs assessment isn't kind of like a one and done thing where you do your survey or whatever it is, your listening sessions, and then publish a report and then you're done with it. Like, it's just this ongoing process of engaging with the community and figuring out different ways to get the feedback that you're after, and using that feedback to inform your work. So thank you for that reminder.
Yeah, thank you. Absolutely. I think that's good to draw out that this is about, the assessments are always ongoing. And so that engagement is always ongoing. And there's different ways and paths and tools. You figure out the paths and tools that work for you and work for your community. Another tool is an environmental scan. So an environmental scan is essentially where you kind of walk in your community or drive in your community to figure out what resources are available. So here you might say, if you were looking to address alcohol use, you might then kind of look at a neighborhood in your community and see, how many establishments that sell alcohol are present in that neighborhood. And how are they advertising, and who are they advertising to, and how easy is it to access alcohol, maybe let's say for youth or minors, if you were looking at underage substance use, underage drinking. Or you might look at where are these establishments placed next to? Are they next to schools? Are they next to places of employment? Are they next to residential communities? So you would really take an idea and scan your community to learn more about it, to see kind of what's going on in your community. And you could do this for any issue, right? You could look at, this is just example was alcohol, but you could look at this for any issue in your community. So you might find, if you were looking at doctors prescribing opiates, you might look and find that in your community, there is a small section in your community where a number of doctors were prescribing the most opiates. And that might be significant to you as you're trying to address the problem. Or again, any issue you could look at, you might look at where are the meetings at, right? Where are the meetings occurring? Are they just on one part of town where the other side of town doesn't have access to transportation to, right? So really thinking about using the environmental scans or walking surveys to understand your community is another tool in that assessment process to understand your community and what's going on in it. And then public records and agency records. So public records are records that you can get from public organization or public agencies that release information that's helpful in understanding the problem in your community. There is a way that you can request records from different organizations, so different government organizations. And there is a law, the Freedom of Information Act, that requires them to share this information with you. Now, some of this information is restricted. We don't have access to things like people's confidential medical records or things like that, or maybe like law enforcement records or anything that's going to jeopardize public safety or national security. But there's a number of things that you can access. I'll tell you that I did access recently for the state of Ohio. I wanted to have a list of the licensed social workers in the state, and the licensing board from the state provided that to me. It provided their name, their address, their email, their license, a number of different things that was available to me just as a citizen requesting this information. Have any of you had experience requesting public records?
I have. I actually just recently acquired a list of every licensed therapist in the state of Minnesota. And I had to send a check for $5 to DHS. And they sent me the list. There are 4,000 names on it.
Mm-hmm.
Yeah.
And how does that help in your planning now?
Well, this is actually, I have a business outside of the work that I do for the Peer Recovery Center of Excellence. So where I combine fitness with recovery coaching. And so I sent that list of people my newsletter in hopes that I would get referrals. But, you know, in terms of like trying to reach people in the community who are, you know, working with folks who are experiencing, you know, substance use challenges or their families, that would be a good, you know, if you're trying to put together a listening session or send a survey or something like that, like, you know, those lists are available. And it's a good, and I'll tell you, I actually was trying to like create my own mailing list, and I was like spending hours doing it. And I thought, there's got to be a better way to do this. And I just thought maybe there's, you know, maybe DHS, the Department of Human Services in Minnesota, you know, makes it public, and I sort of stumbled upon it. And I was blown away. I was like, oh my God, here's the list and it's only $5. So this is a good example of sometimes there are resources out there that you wouldn't normally think of. Mm-hmm. Yeah, it's a great one.
Absolutely, for your planning. And you might get like the county auditor in your state or your county might have a list of homeowners, right? So that you can engage a certain neighborhood or the people, invite them to listening sessions, or the State Department of Mental Health may have a list, maybe not of people's names, but they might have a list of organizations that they've worked with to be able to engage those or who've received that type of funding. So whatever you're planning, the planning that you're doing, having available these records is sometimes very essential. Agency records are similar, but agencies are not under any obligation to provide that information like public agencies are. So these are more private agencies and nonprofits. they're not under any requirement. So that's why having them as part of your coalition is great, because then they can bring their resources to the table to share those with you as well. And then finally, with asset maps, this is the idea where you want to take a map and plot where the assets are in your community. So you want to know where the treatment centers are. You want to know where the different meetings are. You want to know where the different resources that you all in your community find as valuable. You want to know where they are. This is one, there's a number of ways to plot those. You could drop pins on a map, but you could also kind of just use graphics and kind of identify, okay, well, there's food sources here in my community, and there's libraries here, and maybe libraries are something we want to partner with, right? Or over here, maybe these are community centers that have, or these are hospitals, so we want to know where the healthcare centers are. Maybe these are beds for residential, or beds for emergency crisis beds, right? Observation beds. So again, being able to map it out really helps you have a good visual of what's available in your community, and you can very quickly identify where the gaps are. So here, if we were looking at the map of the United States, we could see that there may not be any resources in Kansas, right? From this map that I just created, right? I'm sure there's a ton of resources in Kansas. But from this map, you can see that there may not be any resources here, or maybe even over here on the East Coast might be a little bit shy of resources too. So that's a huge asset to be able to then use this to engage different entities in your community to say, hey, could we partner with you, library? Because we see that there's a number of them here, and we're doing something in the Midwest, and we see that there's a number of libraries that are in the Midwest that might be a great place to engage people and to work with people. So again, asset maps are a great tool to really be able to see what are the resources that are available in your community. And then the final thing I want to touch on real quick is that we talked about also the need to engage subgroups within the recovery community. And part of that is making sure that when we are collecting data, that we're using diverse data collectors, right? And I'll give you an example. When someone comes to your door, I'll give you an example of why. So when someone comes to your front door, when you're at home and they ring the doorbell, what do? If you're like me, I get really quiet, right? I'm like, oh, I don't know that person. I don't know why they're at my door. I get my kids quiet because I don't know. And I kind of tiptoe to the front door and look out the people and say, who is it? If I don't know it, I'm probably not going to answer it. They can leave a message, right? They can leave some literature or whatever they're trying to leave at my door. They can leave it there. But if I go to the door and it's my neighbor, I'm going to open the door because I know them. And that's the same thing we want to think about with, data collectors, right? If we have more diversity from our communities, then it's more likely we're going to get people engaging with us, because we want to make sure that we're using people that are closely tied to the community and they're asking the questions. Another thing is making sure that we're including local experts and community leaders, right? We informal and formal leaders to ask those questions because people are already connected to them, right? I think that's very similar to the example of partnering with the faith-based community. We also want to allow members to review and edit the questions and material to make sure that the questions we're asking around the problem is respectful of the community and respectful of the people that are experiencing the problem. And then we also want to use interpreters as needed. And then we also want to think about cultural informants to understand group norms and concerns, right? We want people that understand the community that we're serving, because sometimes as outsiders, we tend to look and see things that and judge things as abnormal that aren't abnormal, right? And if we were part of that community, or that we understood the group norms better, we would actually see that, oh, okay, this is how this behavior, or this how this behavior or how this is playing out in the community, and it's not what we thought because we weren't familiar with it. And then again, we want to host town halls or listening sessions or public forums. Do that in a space that's known and recognized and comfortable for the community. It'll engage more people to have them there. They'll feel more comfortable. They'll feel more at home. They'll already have engaged with this community space, so they know it. And then we also want to think about having key resources and our asset maps that serve diverse individuals. So we don't just want to have the resources that reflect the majority in the community. We also want to have resources that are important to people that are kind of in a minority within a community as well. Any questions?
Would So when you were talking about the environmental scan and kind of a walk, walking through the community, do you have any tips on, like, say there's a high prevalence of, just say, liquor stores? Like, do we invite them into the conversations to our coalitions, or like, just could you talk through some of that, like the maybe pluses and minuses of inviting in people we may seemingly be working against?
Yeah, absolutely. I think it's always good when you're working, and especially when you're doing that assessment, to know who may be opposed or who may have other interests, because they can really halt your efforts, or interrupt your efforts, I should say. Maybe not halt, but interrupt your efforts. And so that might be, you know how they say, keep your friends close, but your enemies closer. It might be one of those things where you really want to engage with them. One, it may be just unintentional, that they may be trying to run a business and not really realizing the impact that they're having on the community. And they might be very willing to change and join your coalition, to do something different. They might change how they're advertising. They might change what that messaging to the community looks like. So you really want to make sure that you're understanding kind of who the players are, and then deciding as a group, do you want to invite them to the table? Do you think it would be, after conversations, do you think they would be agreeable or on board? And if not, that might be one of the areas that you look at in the community for intervention, right? You might find that there might be a lot of messaging for alcohol around there. Well, then maybe additional messaging could go up as well that kind of counteracts their messaging. So you would think about, what are the strategies, depending on whether they're kind of agreeable or looking to collaborate or not. What are the strategies that you could do in those particular areas to intervene, especially if it's a root cause or really a huge risk factor to the community.
Eric, do you want to ask your question?
Yeah, it's not exactly a question, but just to following up on that, this is an incredibly small scale. One of the things that sometimes can be a connection to folks in the environmental scan area is, I've got, for example, a place near me that is basically a convenience store that much of what they sell is alcoholic beverages. And they have quite a problem with people hanging out there. They're have a security issue with folks. And actually, I've managed to get them to take some pamphlets and some basic some little stickers and hand them to people as they get them shoveled away. And we've gotten several folks who've come to us from that convenience store. So there sometimes is at least potentially some things in common, and with folks who are handing out substance uses and drugs. You can sometimes get there, and I've even, because I'm pretty connected in with some folks that maybe I should or shouldn't be, regardless. I've had now 3 times in the last couple of years someone who is selling things that are not legitimate, to send someone to me. So you don't know. I mean, there can be, because that person became a problem for them. And so you don't know. Sometimes there can be little connections like that. Anyway, just an observation. Thanks for listening.
Yeah, thanks for sharing. I think that's powerful, right? It's kind of the unassuming, or the person that we don't think would necessarily be a partner turns out to be a partner, right? Yeah. And I definitely want to, thank you all. I love the conversation. I love the feedback, and I love the kind of the knowledge that you all shared. I hope you guys were able to kind of, connect with people even outside of this to see, if you have additional questions, maybe someone shared something that you want to know more about. But I definitely want to thank you. Definitely want to thank you for being here. I do have an additional slide that I need to share with you, but I switched PowerPoints. So if anyone wants to jump in, I see someone in the chat. Let me go ahead and stop sharing for 1 second and reshare. Oh, there you all are.
Thanks, Mitzi. I'll just go through. I think Mitzi's going to be putting up a link to an evaluation. So we just do a 2 to 3 minute evaluation for each session, and we'll send it out after the session as well. And then once she gets that slide up, I'll have Mitzi talk about the extension learning opportunity again, because this is a 6-month long series, one meeting like this a month. We wanted to create some opportunities for you to engage with these materials in between the sessions. So I think Mitzi had mentioned she'll be sending out a list of those tools or the ways that we can do different types of community assessments. It's not always a written survey. Like there's a lot of different ways we can do assessments. And so I'll let her talk that through. If you have a smartphone, you can just open your camera and point it at that QR code on the screen. And like I said, that'll pop up a window. You can click on it and then do a 2 to 3 minute survey about how you felt the session went today. And then that link at the bottom of the screen will send out in an email afterwards. But Mitzi, if you want to just talk about the extension learning.
Yeah, thank you, Chris. So the extension learning is going to give you a ton of more resources around these topics. If you want to know how to conduct a focus group or a public forum or any of the things that we've talked about, there's usually a toolkit for it. So I've compiled those toolkits from different just resources, and I've compiled them for you and kind of put those on a spreadsheet so that you have them. The other thing you'll see is that there's a TED Talks that kind of further this conversation. And as you listen to this TED Talks, I've also added things to kind of think about, questions to kind of consider. And so you'll watch the TED Talk, and then there'll be kind of my thoughts and comments for feedback as well, so that we can continue this conversation throughout. But you should see a number of different resources in the Extension Learning Center. That's available not just for this time, but then if you want to go back to the first month extension learning, you'll see, a resource as well around the community toolbox, which is another resource of hundreds of resources around this engagement and around community and change. And so again, we encourage you to just kind of, if you to try different advocacy skills, especially the ones that you're learning, or even participate in them. There's this ongoing kind of challenge to really engage with the different, to engage in these things and share your stories, right? So next time, before we start the next workshop, we'll talk about how that went for you all, if you were able to. It's not mandatory at all, but we're just trying to see, give you kind of that platform to experience things and ask questions as needed.
And then I did just put into the chat a link. So Cindy was nice enough to create what we call a landing page for us. And so the link in the chat will contain information about all the sessions in one spot, including links to those extension learning opportunities. And then after each session, we post the recording of today's session. So if there was something someone said that you want to review, or you missed session 1, you can watch a recording there. And so again, the idea is that we start to kind of build on our knowledge as we go through this process. And if you miss something, there's a way to go back and get that information. Any final thoughts or questions anyone would like to share with the group? Sounds good.
I just want to say thank you to Mitzi and to everyone. I think this has been a really great session, and thank you. Thanks, Chris and Cindy.
Yeah. Yeah. Well, thank you, everyone. We're back together with this group next month. And the same time, we did do a little bit different process. So we are asking people to register for each of the 6 sessions separately. But we will send that information out, like I said, with that extension learning in opportunity. And, Mitzi and Kobe are always going to be available to engage further. And so we'll explore that if there's a topic that I really need to do something in my community, you can reach out and put in a request for technical assistance from the Peer Recovery Center of Excellence. And we could certainly engage Mitzi and Kobe to do some work one-to-one with the community. We have lots of different consultants and subject matter experts that we work with. So there could potentially even be somebody in your community that we connect you with. But I really appreciate all of you spending your time with us today. I know our time is very precious. And so I just appreciate you showing up and engaging and making this a really fun session.
Yeah, thank you all.
All right, thanks so much.
Bye.
Have a good day.